Hi everybody, welcome to the Power Up from Primary Care IT and IATRO. We're dead excited to be talking to you today about our new exciting product, OneContact. So this is a joint venture between Primary Care IT and IATRO. Those of you that know us know that we're all about just trying to collate good stuff and get it out to primary care. And that's the whole reason that Primary Care IT was set up in the first place. And with COVID coming along, there's been a real need to be able to communicate with our patients in a different way. And particularly, I mean, in our practice, we've found being able to communicate with them remotely would be a real benefit for our practice patients. So we've been working with IATRO to deliver exactly that, which is dead exciting. So what is OneContact? It's a remote monitoring tool that allows you to review patients remotely, safely, with high quality reviews. So today we're going to talk through that process. We're going to talk about what the reviews look like, what happens when you get the information back and into EMIS or other clinical systems, and what other tools and how it integrates with our other tools as well. So the process works something like this. So the clinician decides that the patient needs a review, and then they can click on our widget to generate a code. So what this is a Windows-based application called OneContact, and you double click on that and it brings you up a little box like this, which you can see has 3 different boxes. So you've got send for a review, which allows you to send a review off to the patient, or you've got see my responses, which is viewing the responses that have come back from patients. And you can see there's another box here which is all about me and my role within the practice and which groups of membership that I am in within the practice. So when I click on send a review, I get a box that pops up like this, and it asks me which review do I want to send. So the whole idea of this tool is that it's for a wide variety of long-term conditions, because with COVID, what we're not wanting to do, if we can possibly avoid it, is bring tons and tons of patients down to the practice, where they may come into contact with other patients who've got illnesses. They may come into contact with members of staff who potentially could be carriers for illnesses. So what we want to try and do is do as much of this work as we possibly can remotely, and then only bring the patients in for what we have to bring them in for. So I mean, looking at this list of things for asthma, it may well be that we need to do a bit of a video consult to look at inhaler technique, or we may not. We may be able to conduct that completely remotely. For things like diabetes, we probably still need to get patients in for foot checks, but there's a large amount of the review that can still be done remotely. And what we've tried to do with these reviews when we've been creating them is make sure that they're as comprehensive as they can be, while still being digestible to patients, and whilst making sure that bits and pieces that the GPs need to do or the nurses need to do are highlighted to people when they're coming back into the practice. You can see we've got a pretty comprehensive list there, so that's not exhaustive. There are other reviews that we've got on top of that list. You can see they're going off the bottom of the page there, but there are a good number of clinical conditions, and we expect to add to this as time goes by. Where there are new ideas or new things that we could be adding to this, we'll be adding these into the system as we go. So we've clicked on the widget to generate the review code. That gets sent to the patient either via text message or by email, and the patient gets a unique URL that they can then click on. So they can use a mobile device for that, they can use their computer for that, they can use a tablet for that. It's not fussy, and it's all in very nice NHS kind of standard branding and standard colours. So if they're used to using patient-facing services or the NHS app or any of the Choices websites, it will look fairly standardised to them, and that's in keeping with all of the work that I actually do with their website. So it's well worth checking out their websites if you haven't had a chance to do that already. Certainly the transformation with ours has been pretty huge in terms of the improvement. So the patient goes through, completes the review, parts. So some of the reviews may need to be paused. So for example, the blood pressure review asks them to collect details of their blood pressures over several days, so they can submit one day's worth of, or the morning's worth of readings, and then close the review. They can then click on the link again, and it will take them straight back into that that same part of the template that they can then complete the afternoon's readings in, and then they can do that on subsequent days as well. So the system's clever enough to remember whereabouts the patient's got up to in the review. And for some of the longer reviews, for particularly things like learning disabilities review, that can be really quite useful because the reviews can actually be quite lengthy. Once the patient's completed the review, that then drops back into our widget, and then the clinician decides what they want to import into EMIS. So you get a screen where you can look at the data that the patient has highlighted, brings to the top all of the relevant important information. So if the patient said that they want to contact the practice about something, or if they've said they're not happy with inhaler technique, or if they've said that they've got active foot problems in their diabetic check, all of those kind of red flags are brought to the top of the information box when it comes back into the widget. And then the clinician can then choose which codes they want to import into the record, and that is the point at which you would usually then conduct your review with the patient. And then the clinician can use our tools, if you're a subscriber to Primary Care IT, to actually analyse the responses that have come back in from the patient. So probably the best thing to do is to have a look at some of these tools. So this is our asthma check. You can see there's a nice little widget across the top that tells you how many percentage you are all the way through. It double checks that you're taking inhalers for your asthma, because some people aren't, and then it gives you some hints and tips about what to do before the review, and what kind of things you might want to be thinking about. First section is asthma control, so you can whiz through and get them to put in descriptors as to how they're getting on with their asthma control, and then you can go through and score how your asthma control feels. We've got all the asthma control test questions, so you can go through and complete all of those. As you go through and complete those, it then calculates your asthma control test questionnaire score for you. Again, when you're importing this data, it just means that it's saving you all of that time in having to do this manually, or using a template. It's just going to drop in that code for you. Flags to ask if your asthma is worse when you're at work, and what in particular at work is making your asthma worse. So that can be quite useful to identify those kind of occupational causes where there may be an issue with it. Then we can go through and do the RCP questions, and that will allow us to see what's going on from that point of view. We've got inhaler technique then, so there's a self-rating score. We're having some interesting conversations with some of the clinicians from Asthma UK this weekend on Twitter about whether we think that this way of doing asthma reviews remotely is validated. I think the evidence is out on that one, and this may be where you want to jump onto a quick video consultation to actually have a look at some of these inhaler technique. We can even go as far as putting in peak flows if the patient's got a peak flow meter, or if they know what they're doing with their peak flows, and then the system will automatically calculate the numbers that you need to watch for, so the number of which you need to be worrying a bit and the number of which you need to be worrying a lot. We've tried to be quite clever with the questioning, kind of making sure that we almost give patients permission to highlight if they're not taking their inhalers properly, or if they're not, or if they are still smoking. So you'll notice in the smoking section when we get to it, it says if you put in ex-smoker, it'll say, well, how are you getting on with not smoking? Because it's like we're trying to create the kind of discursive kind of conversation that you have actually in practice with patients, rather than it just being yet another tick box form that patients need to complete. You can see some of the stuff that's highlighted in bright yellow. Again, this is all in keeping with the NHS kind of branded guidelines. So you can see we've got information here about exacerbations, how many A&E or hospital admissions we've had, and whether we've had any visits to A&E or admissions to HDU or to ITU. So you can see it's fairly comprehensive as we work our way through. I'm just conscious of the time because we've only got 15 minutes this morning, so I'm probably not going to complete all of this. So never smoked, nothing comes up. Ex-smoker, how are you getting on with smoking? Current smoker, consider giving up smoking, and then ask them about whereabouts they are in the cycle of change for thinking about giving up smoking. We've then got height and weight, and we can put in all that information. It automatically calculates the BMI for us, and again, all this information can then be dragged back across into the records. So we'll just finish that one off. We've got diabetes, which I was going to show you as well, but I think we're running late on time for that at the moment, so we might nip through from there. We've got admin tools as well, so it's not just for clinical reviews that we can send these kind of tools out. We can embed within your websites certain tools that help you to offload certain bits of work. We're really aware that there are lots and lots of different systems for online consulting, and the bit that we felt as a practice would be really helpful would be if we could just pick one or two particular areas where we could just offload that and allow all of that to be done electronically. Sick notes was one of them, so we thought if we could just take those and have that on our practice website and actually redirect any patients who are requesting sick notes or any form of paperwork to be completed to our website, and then that would help us to save on telephone calls coming through so that we could deal with the increased volume of calls that we're experiencing, because we're doing more of a total triage now every day, and so our telephone consultation, our telephone volumes have gone up quite significantly. The other area that we're looking at doing that for is for medication queries as well. So if there are queries about medications, again, that's something that we're probably going to offload to our website, and we've got a variety of different tools for this, which you can incorporate within your website as well. I'll just move on to the next slide there. So medication query, you can see that one. This is just to finish off with what it looks like when you use our tools within EMIS. So you can see when you pull it back into the clinical system, you can then run one of our protocols as part of the primary care IT package that then analyzes the responses that you've had. So, and you can see it puts little crosses or little ticks by the things that are relevant. So we've got a cross by the fact that this is a current smoke. So this is an asthma review that's coming back. You've got a cross by the fact that this is a current smoker, but a tick to say that they want some help to give up smoking. We've got the occupational trigger. We've got the fact that they want somebody to contact them about their inhaler technique, the fact that their BMI is raised, and then they've got an unanswered question saying that they need another inhaler, and that they've said that they're happy for the review to be completed without being seen, but it's flagging that there are these above issues, so it's saying we shouldn't really be completing this review without looking at these issues. So in this instance, I'd run this protocol, it will pop up with this information. I think, right, I need to dive on with this person because I need to speak to them about smoking. I need to speak to them about what on earth is going on with their work. I need to talk to them about their inhaler technique and have a look at that. And I need to look at have a word with them about their BMI, sort out an inhaler issue. And so that's going to be a bit more of a lengthy review. In the first lot that we've sent out from our practice, we've had 3/4 of them come back within 3 days of sending them all out. So it's a really, really high pickup rate. The other thing that we've noticed is that we've picked up patients where we haven't been able to access them before. They've not come in for asthma reviews before, even when we've now pestered them. But actually filling in reviews remotely means that they're actually willing to do that, and it's really engaged the patients in their asthma reviews. The other thing that we've noticed is that 3/4 of those 3/4 that have submitted the reviews are more than happy for the review to be completed remotely and actually haven't had any issues that we've necessarily needed to pick up on. So it's meant we've managed to complete, I think, of the 78 reviews we sent out this month, 3/4 of those have been managed to be dealt with remotely. So it's really helped in terms of kind of workload within the practice. You've got more details here if you need them. So you've got all about the asthma control. So you've got the asthma control test scoring there. You've got the RCP question answers, and then it tells you what the patient would do if their control was getting worse. You've got the information about inhaler technique. You've got all the peak flow information there. And then you've got all the information about preventers, and about exacerbations as well. So that is a very quick run through OneContact. We're taking expressions of interest at the moment, so if people are keen to look at using this within their own surgeries, if you pop onto the links that we'll send you after the event, or on the front page of the presentation, head to primarycarepathways.co.uk, head to products and then OneContact, and there's a link on there which, if you submit through to us, will come into our inbox, and then we'll be in contact with you when we're ready to roll these tools out. But thanks for joining us today, and hope that's been useful to you. Speak to you all soon.